Hello, this is Sean Collins, and welcome to Tutorial 4. Sorry about the end of Tutorial 3B. I had totally forgotten about Tutorial 4, which gives me an opportunity to say more things about the normal response. Essentially, when we're talking about the non-disease specific impairment response to activity, we're talking about normal responses. So to keep us on track, we are talking about the non-disease specific cardiopulmonary response. So, is an endurance limitation. So there is an endurance limitation, and we are trying to decide whether or not the endurance limitation is disease-specific. So disease-specific would be yes, and what we're talking about now is determining that an endurance limitation is not disease-specific. So we're talking about an endurance limitation that is not disease-specific. Now, in the previous tutorial, I specifically discussed the difference between not being able to attain a workload versus not being able to sustain a workload. So not being able to attain a workload would be the inability to achieve that workload. So if the workload is stair climbing, not being able to do stair climbing at all would be not being able to attain. Whereas for endurance impairments, we're talking about not being able to sustain. I'm going to go out on a slight limb here and say that most of the time when somebody can't attain a workload, it is a strength limitation, strength-related impairment. It could also be balance, it could also be range of motion, it could also be coordination. There are definitely other impairments, but in the cardiopulmonary population, if they cannot attain a workload, it is usually that they're not strong enough from a muscle strength perspective. And the good news is that is definitely a non-disease specific impairment. So in some regards, this is pertinent for this tutorial in that by not being able to attain the workload of stair climbing, the individual is showing that they don't have the strength to do that, and building strength is not limited by the fact that they have a cardiac disease or a pulmonary disease. There are ways to gain strength in those patient populations that is not hindered by their primary disease. Another way of saying this is that decreases in strength are reversible. They are reversible. So, from this point forward, we will continue to talk about the ability to sustain. So, get to a workload. So, climb enough stairs. Whether they can climb enough stairs. And if somebody can climb stairs, but they can't sustain stair climbing for enough time to get up the number of flights they need to get up, or if they can achieve the workload associated with walking, but they can't walk long enough to get to where they need to go, or if they can achieve the position of standing and even start to fold their laundry or prepare a meal, but they can't sustain it for a period of time necessary to complete the task, then they have an endurance limitation. What their cardiopulmonary system would do is respond normally, meaning heart rate would rise and it would get to a peak point, and it would then the workload would have to stop, and it would drop. Systolic blood pressure would rise. Diastolic blood pressure should stay the same. SpO2 should stay the same. Shortness of breath might rise. Fatigue will rise. Respiratory rate will rise. Depth of breathing may not rise tremendously in people with obstructive lung disease, but it will rise in people with heart failure. The overall ventilation will increase in people with heart failure. Their ventilation will be adaptive to the workload if it is not the limiting factor of their endurance. So let me give a quick scenario of an individual doing a 6-minute walk test, and we're going to assume that they're going to walk at the same pace during the 6-minute walk test. So by walking at the same pace, they're going to be achieving a particular workload, and they're going to maintain that workload for the full 6 minutes if they actually can sustain it. The normal response for someone who does not have an endurance limitation would be a heart rate that rises, plateaus, a respiratory rate that rises, plateaus, a systolic blood pressure that rises and plateaus, a cardiac output that rises and plateaus, a oxygen consumption that rises and plateaus, the oxygen level in the blood that stays constant, a diastolic blood pressure that stays constant. These would be normal responses for someone who does not have an endurance impairment for the ability to sustain walking for 6 minutes during this walk test. Now, we're not saying anything about what this level is, what this pace is. This pace might be really slow, but they can sustain it for the full 6 minutes. Someone who cannot sustain a chosen pace, this might be, for the sake of this example, let's call this the walk min, the minimal speed someone can walk. And let's say that this individual cannot sustain it. They cannot sustain this workload. And so they have to stop. So their workload drops to nothing, and then after a little while they pick it up again and they start to walk until the end of the test. So they have a 6-minute walk test, and they've walked for 3 minutes, and then they've walked again for 1.5 minutes. I know that's not to scale. So what would happen is their heart rate, if they do not have a cardiopulmonary limitation to workload, their heart rate would continue to rise, and then it would come down once they stopped walking. And then once they started walking again, it would continue to rise. Their systolic blood pressure would follow the same pattern. Their cardiac output would follow the same pattern, though we can't measure it. Their oxygen consumption would follow the same pattern, though we can't measure it. Their diastolic blood pressure would stay constant. Their SpO2 would stay constant. their respiratory rate, ventilation, and tidal volume would follow this pattern of increasing until the point that they stop, and then it would drop during recovery, and then when they started to walk again, it would increase. So we would see these fluctuations, but they would be normal responses based upon a cardiopulmonary system that is capable of adapting to meet the needs, the demand. This walking is the demand, and these are adaptive responses. They are not capable enough of converting energy at a rate that allows them to sustain the walking, so they do not reach steady state. But they are, in fact, able to compensate. They can't sustain, but they can compensate. So in the next presentation, and I'm going to confirm this before I say it, tutorial 5, we will talk about cardiopulmonary disease-specific responses. So heart failure in particular we'll talk about next.